So when you look at the studies of ACL reconstruction, most studies show there's about a 12% chance of re-tear. So you go through this whole surgery, you do 9 months of rehab, and then you re-tear your ACL. And 12%, those odds are pretty high. And so we're constantly focusing on new ways to optimize the surgery to reduce that re-tear rate. And we're also looking at ways to make surgery less invasive so that, if God forbid, you have to have another surgery, that it's not quite so invasive. We've added procedures in some cases called an LET or an IT band tenodesis to tighten up the lateral side of the knee to make the chance of re-tear less likely. And now we're doing that surgery in patients who are very, very flexible. In other cases, when the patient's already torn their ACL for the second time, we start looking at other factors in their knee. We look at the slope or the shape of the shin bone and how slanted it is, because we know that patients who are more slanted are more likely to slip forward. And so in some of those cases, we change the slope, and that's the only way we're able to get their knee stable. I think ultimately, the one thing we can tell every patient is the longer they wait, even though it's really frustrating and annoying, the less likely they are to re-tear their ACL. So the difference between going back to sports at 6 months and 9 months, even if they're really strong, is that they have a much lower rate of re-tearing their ACL.